I am Lena Sun. I'm the Chief of Pediatric Anesthesiology at New York-Presbyterian, Morgan Stanley Children's Hospital. Every parent is always anxious when their child has to go through something that they have no control over. And certainly having them come to surgery, having them undergo anesthesia is a very, very anxiety-provoking experience. And the way we deal with it is we talk to the parents. We really try to explain to them what it is that we are trying to do and to reassure them that here at Morgan Stanley, we actually have exceedingly well-trained people that are really the best in the field in doing what they do. We also, we have multiple ways of allaying that anxiety, talking. Sometimes we allow the parents to come with the child, to be there with them as they go to sleep. We always give children just enough to make sure that they are comfortable, they are not in pain, that there are adequate conditions to do the procedures, whether it be surgery or some other procedures. We monitor all of their vital signs to make sure that they are in a very good range. So I can't tell you exactly what dose it is, and that is where the expertise comes in. We all have an idea in terms of the range of the doses that you should be giving, but to give just the right amount, just enough to do the right thing, that's where you want to go to a place like Morgan Stanley Children's Hospital to have your children taken care of, because here are people that practice is not just medicine as they practice medicine both as an art as well as science. I think one of the things we always make sure that the parents understand is that the child needs to not have anything to eat, and for a good amount of time, between 8 hours or more, and then they can certainly have something to drink, but it has to be clear fluids. These are some of the things that parents feel the most concerned about. Why is it my child is not having something to eat or drink? And so my assurance to the parents is that yes, your child may not be able to have anything to eat, but he or she can have something to drink up to 2 hours as long as clear fluids. So that should make the child less uncomfortable. And when they come, they will be met by the anesthesia team. They will have the opportunity to meet both the physician in charge of the child's anesthesia as well as someone who is a trainee that's working with the faculty person. That's what we call the anesthesia team. They will speak with the parents to sort of find out a little bit more about the child's medical history, why the child is here. We'll explain what to expect. The nurse will take the child into the operating room area or into the area where the anesthesia will be provided, and the parents will wait for the duration of surgery. But as soon as the child is finished with the procedure, the child will go to the recovery room and the parents will be able to see the child there. They can also expect that if there is any discomfort or if there is any concerns, that the anesthesiologist will be right there to deal with that. Our job is to make sure that the entire experience is as stressless as possible, and the child's experience is as comfortable as possible.